Now, what's happened is that the complication rate, and the complications can range from simple things that happen with every operation, like bleeding
Sure.
and infection, exceedingly low, to things that happen when you're working around lymph nodes. There's some little nerves that often run through the lymph node basins, and probably 5 to 10% of patients will note some usually transient numbness or nerve irritation after these procedures. Probably the thing that we worry about most is swelling or something called lymphedema, in the extremity, whether it's the arm or the leg. Lymphedema in the arm is very uncommon, 1 or 2% of people. Lymphedema in the leg, particularly after lymph node surgery, can be 3 to 5%. It's usually not massive lymphedema. It's usually a little bit. Of course, perception is everything, and the physician's perception of the degree of lymphedema is never the same as the patient's perception of the lymphedema, and we completely recognize that. But it's one of the things that makes us want to look for a procedure or some information that we could get the same way without taking that lymph node out. And I'm sure we'll get to that a little bit later. Because if you get the lymphedema, it's usually permanent. It doesn't go away. We've looked for predictors of who's going to get it, and the best we could do are the older, overweight people like me, but not you. But the fact of the matter is that if it's just for information and does not affect the outcome, which is true,
sure,
then is that 2 to 5% risk of lymphedema worthwhile? And I, in general, young people will say, yes, I really want to know, and older people say, I'm less interested in it.
yeah.
So we don't tell people they have to have a lymph node biopsy. We offer it to them. We explain to them why we might want to do it. We tell them what it would cost them to do it, not dollars, but in terms of the things you've talked about. And we also try as best we can to tell them what their cure rate would be without a lymph node biopsy, and then how a lymph node biopsy would refine that estimate into a lower risk group with the negative lymph nodes, or a positive risk group with a higher risk group with a positive sentinel node. So we work very hard to try to get people to wrap their arms around it. As you well know, people with newly diagnosed cancer are so anxious, it's very hard for them to incorporate all these facts. And oftentimes it's a, what would you do, doctor, if it were your son or your family?
Exactly.
Family.
Yeah.
My answer is the same as your answer. All of my patients get treated like my family. There's no double standard here. And I would recommend this, or I would recommend that. But we're realistic about it. It's not part of treatment.
I think the most important thing for people to understand is this procedure, the sentinel lymph node biopsy, is really valuable for determining prognostic information, right? Yeah. And